Hello, everyone, and welcome to today's ASPPH Presents webinar, Truth Telling in the Age of Health Misinformation and Disinformation. I'm Tim Leshin, the Chief External Relations and Advocacy Officer here at the Association of Schools and Programs of Public Health, and I'll be your moderator and I'll participate in the conversation today. This session is focused on how misinformation and disinformation affect public health and how we can respond, not just as individuals, but through collaboration, trusted communication, and community engagement. Before we go much further, I want to take a moment to acknowledge that on Friday, a gunman shot many rounds into the CDC building and killed Officer David Rose. This tragic act of senseless violence occurred near the Rawlings School of Public Health at Emory University, one of our ASPPH members. Our hearts go out to the CDC, Emory, and of course, Officer Rose's family. We may get into some of the reasons why the gunman was able to do this in terms of some of the misinformation that may have caused him to do this. So today's conversation is based on excerpts from a newly released two-part podcast addressing health misinformation and disinformation to advance truth-telling, produced by Partners for Advancing Health Equity. The podcast series was released in July and brings together voices from across sectors to explore the causes, consequences, and solutions to public health misinformation. You'll see this, the three of us will be on there. Partners for Advancing Health Equity, led by ASPPH member, the Celia Scott Weatherhead School of Public Health and Tropical Medicine at Tulane University, that's a mouthful, promotes research, learning, and collaboration across sectors to advance health equity. You'll hear that perspective reflected in the podcast clips and in today's panel. So the format for our session today includes opening remarks, two curated podcast segments, and panel discussion after each clip. We'll also close with a bit of time for the Q&A section, and I encourage you to add questions in the Q&A section of the podcast of the webinar. Sorry, excuse me. Okay, with that, I'd like to introduce our two featured guests. Dr. Karen Bell is assistant professor at Tulane University Celia Scott Weatherhead School of Public Health and Tropical Medicine, and associate director for Partners for Advancing Health Equity. She'll start us with reflections on how cross-sector partnerships, not just within public health, are essential to building trust, advancing equity, and addressing complex challenges like misinformation. Then we'll hear from Erin O'Malley, Executive Director of the Coalition for Trust in Health and Science, a coalition ASPPH is a very proud member of. Erin brings deep national expertise in the strategies needed to help individuals and institutions build trust, improve media literacy, and navigate a saturated, emotionally charged information environment. So I will now turn it over to Dr. Catherine Bell.
All right, thank you all. Karen Bell here.
Karen, I can't believe I did that again, but Karen, there you go.
Totally okay too. Thank you for having me and for that introduction. I'm saying hello to you all from New Orleans, Louisiana, here at Tulane. And like Tim said, here at P4HE, or Partners for Advancing Health Equity, which we call P4HE for short, we work on cross-sector work and focusing on how we can all work together to advance health equity. And I think that is critical right now, given our context where we have an administration that is trying to dismantle traditional public health institutions, including schools, as well as what we understand as traditional public health and public health practice. And so I think it's really important for us in this moment to expand our thinking about what and who public health is. And so for P4HE and for my work as well as a researcher who does work in the community, I really am working on, for myself and for my students, encouraging us to look to the expertise outside of our traditional institutions of public health, because for one, we might have to go outside of these institutions for our own jobs, but really, and I'll probably say this multiple times, the solutions are already in the community, and it's really our job to uplift those and use what we have to serve others by uplifting those solutions that are already there, those ideas that are already there. But I do want to spend just a little bit of time talking about P4HG, because we have spent the last quarter addressing misinformation. So I think you can move to the next slide. Yeah, thanks. All right, so this is P4HG, Partners for Advancing Health Equity. We're a national research learning collaborative that supports the work of people dedicated to pursuing health equity. We're funded by the Robert Wood Johnson Foundation, and we're focused on those cross-sector collaborations, really to advance equitable solutions that are actionable. You can go to the next slide. This is sort of our format. We think of the work that we do across these 5 sectors, but that's just how we've formulated it. It can really be anybody who is looking to address health equity. We have a very large membership, both individual as well as institutional members. You can go to the next slide. You can also go to our website for this information, but we have webinars, podcasts, blogs, research, workshops, and an upcoming summit in December of this year in Montgomery, Alabama. But all of that work is looking for actual solutions, not just talking about health equity, but actually doing something about it and developing those solutions together. Next slide, I believe. Yes. So each quarter we work on a specific theme to advance health equity. We came up with these themes for this year based on the work that we've done in the past, the visioning from our National Advisory Committee, and honestly visioning from our membership. And in quarter 2, you can go to the next slide, please. Thank you. In quarter 2, oh, back one slide. Okay, thanks. And in quarter 2 of this year, we focused on addressing misinformation from a cross-sectoral and equity-based lens. As you can see here, we have our blog, recorded workshops. We had an interacting learning session with our membership, the podcast, which you'll hear parts of today, and a webinar with a journalist at CNN, which he really changed how I thought about some of these topics. And I'll probably mention that more. And the webinar also had a consultant who works on, among many things, addressing misinformation through health equity work in healthcare and public health practice spaces. So I just wanted to give some information about P4HE, since we are using our podcast that we had with Tim and Aaron as the basis or part of this conversation today. So thank you.
Thank you, Dr. Bell. We'll now hear from Aaron O'Malley.
Thank you so much, Tim. I think we're ready for the next slide. And one more. And one more. So again, thank you so much, Dr. Bell and Tim. It's great to be back with you both. It's been about 2 months since we filmed our podcast, which I'm excited to go into detail about today. But just a few notes about our work here at the Coalition for Trust in Health and Science. As noted earlier, ASPPH is one of our founding members and really is a phenomenal partner in our work. So we are a national coalition who is representing just under 100 national organizations. These are trade associations, societies, nonprofits, and foundations who represent professionals in science, public health, healthcare delivery, as well as organizations representing patients and consumers. And we have all together agreed that united, we will work together to build trust and be trustworthy brokers as we engage with the public. Our work really centers around 3 core elements. First, we are promoting and sharing accurate, understandable, and evidence-based health information. And we'll talk today about why that is a tricky thing to do these days. We also work to strengthen trusted messengers so that they can effectively communicate evidence-based information. And third, ultimately, all of this work is to help empower individuals to ensure that they have all of the information necessary to make informed and personally appropriate health decisions that align with their personal goals and values. Next slide. So we are working together to make a difference and see this future together through collaboration, the creation of resources, and engagement. From the professional side, we recognize that of those almost 100 national organizations in our membership, that they are the ones representing the tens of millions of professionals in the field today who are engaging with patients and consumers. And it's our goal to help those tens of millions of individuals ensure that their interactions are built on trust and trustworthiness. So we do this by hosting educational content, including our very popular biweekly learning lunch series, where we bring experts and thought leaders and case studies to our members. We create evidence-based resources. They're on our website. They include things like toolkits, wallet cards, one-pagers. And we also speak on podcasts like the one we're going to talk about today, as well as at professional conferences. From the individual perspective, we work to empower individuals to identify and access accurate evidence-based information through the curation of resources on our website. We have a hub of information of both how to find credible health information, as well as educational content about how do you understand a scientific paper? What is the scientific process? What is misinformation? Finally, we've hosted town halls in the past, open to the public, and have plans to do so moving into the future. Next slide. So getting a little closer to the content of today's webinar, part of our work is recognizing the fact that to empower people to get and access credible health information, it is very hard today, given the highly saturated and politically charged media environment that we're in. Everybody, regardless of who you are, where you sit, where you're from, your age, your education level, etc., we are bombarded with so much information coming from various directions. It makes it very hard to distinguish fact from fiction. It could be hard to filter out good information versus erroneous information. We all know there's definitely been a proliferation of many voices into this media ecosystem these days, from your traditional experts to emerging experts to armchair experts, some might say. And of course, all of this is taking place among a infrastructure that is spreading mis and disinformation. If we could go back to the last slide. I'll round out here just with a little bit of stage setting in terms of misinformation. That is those are the falsehoods, the rumors that are spread without the intention of causing harm, and disinformation, those falsehoods, rumors, inaccurate points that are intentionally spread to cause distrust, to instill fear, as well as to harm. So next slide. And this is my last slide before we get into our conversation, but I would say that if you can take away one really important element from today's conversation, and we'll talk more about it in detail later, it is the fact that and in particular disinformation, is designed to elicit emotion. If and when you come into contact with something that you read, that you see on social media, that you hear from a peer, and your gut reaction is anger, outrage, fear, concern, distrust, these are signs from your brain and your body telling you that you probably want to do a little bit more digging, do some more research to figure out why this piece of information is giving you such an emotional reaction. With that, I'll turn it back to you, Tim, and I look forward to the conversation today.
Thanks so much, Erin. Really appreciate that. So we are now going to play the first clip from the podcast that Dr. Bell hosted. The clip really frames the foundational challenges we face and explains what mis and disinformation are, although Aaron sort of just did that, but we'll talk more about it in the clip, and why everyone is vulnerable and how trust in institutions has eroded. So if we could play the clip, please, that would be great. Not hearing the sound.
I'm happy to start this.
Okay.
So
Great.
there is a distinction between the two, and I'm glad that we're talking about it. So misinformation is false information that is shared. It could be a deeply held belief that someone has. It could be a falsehood that they have encountered and again believe moving forward and something that they share. Whereas disinformation is a falsehood, but is purposely designed to deceive or harm an individual who's receiving that misinformation or disinformation, I should say. So an example of that, or one way to really kind of hone in on the difference between the two, with disinformation, oftentimes there is a connection back to some form of motive, whether it is profit, changing somebody's beliefs or ideologies. Sometimes that line, especially back to profit, can be really bright. So an example of that is the COVID vaccine is bad, buy my supplements. Sometimes that line back to motive and profit is very dim, and you have to do a little bit more digging to figure out where somebody is coming from. But to summarize, misinformation is shared without the intent of deceiving or harming, and disinformation is shared with the intent to deceive or.
Okay. Misinformation without the intent to deceive or harm, but disinformation, there is intent. We are trying to harm people and deceive people.
With a bright line or dim line back to
Okay.
some form of motive.
Yeah. Okay, thank you very much. That was a very clear description. Tim, do you have anything to add to that one?
I think Aaron covered it very well. I would just shorten it to say that misinformation is the spread of incorrect information, and disinformation is when someone deliberately creates a false narrative. Are we going to bring the podcast back up?
It was a 10-minute clip.
Oh, I'm sorry. I didn't realize that that was already 10 minutes. That was very quick. My apologies. But here it looks like if we're done, it spreads it.
Yeah. Okay.
To give an example,
Yeah.
recently I saw a videotape of a press conference of a sports player who that seemed unbelievable to me, very disconcerting, but I believed it. And I was quite concerned, and I contacted my son and I said, "Can you believe that this player was acting that way?" And he said, "Dad, you missed it. This is an AI version of a press conference. If you look carefully, it's not a real press conference." And he said something completely different. So we can all be fooled by disinformation, and we have to really be more rigorous when we evaluate the information we're hearing.
I mean, I don't know if I wouldn't have been, fooled as well. Like, the AI and all of the things that we're experiencing right now can make some things very believable. I want to ask about sort of how that has changed over time. But first, I want to, again, start with sort of another basic question and ask who is susceptible to misinformation or disinformation and why. Well, we can go in the same order, Aaron and then Tim. How about that?
Well, Tim, I think you gave a perfect example of the fact that absolutely everybody is susceptible to misinformation. It is compounded by the fact that we have so many pieces of information and data flowing at us on a daily basis, whether it is through peer-to-peer conversations, consuming news media, engaging in social media, at work, at play. There is so much information coming our way. And so I will share my own story. My dad is a comic reader, and he doctored up a comic one time and sent it to me. And he did such a great job of doctoring it up. I thought it was actually published that way. So again, that's a funny example of how I fell for misinformation. It wasn't even, purposeful misinformation as shared by my father is really more of a joke. But I will say I also today, especially as I am just inundated with information, I will read things and then oftentimes either believe it initially or think about it a little bit more and do more research. So I will say I am, as I study misinformation and promote misinformation education and awareness, I am susceptible to it too.
Yeah, I agree. We're all susceptible to it, especially when it fits our narrative. If we believe something and then we see something, we're going to tend to more easily believe in it. Our schools and programs of public health are really trying to teach students that they have to follow the facts and look at the data and not accept things at their face value. And we need more and more people to really question what they're hearing and check the references and make sure that what they're hearing is actually accurate. Don't just trust the headline that you see and pass it on. Make sure that what you're passing on is a real story with real facts behind it. I know a lot of young people are questioning facts these days, but I think we need to do a lot more work in terms of training the next generation to be more skeptical around information they see and gather. It's hard because it comes so fast and furious, but I think we can do a better job with that.
If I may, two additional thoughts for you. I completely agree on the idea of being more skeptical. And as I do due diligence to the science side of our organization, being skeptical is an element of scientific inquiry and discovery. And so I think being skeptical, doing additional research is a fabulous thing. The other element I'll say, especially in reaction to your comments, Tim, we both, Tim and I, gave examples from our personal lives about how we've fallen into misinformation or falsehood or even a doctored up cartoon. What we here at the coalition care so much about is the fact that when we're talking about misinformation, disinformation in the context of health and science, it is not as simple as which sports team might we follow or what brand might we decide to buy or protest. This is information that is explicitly linked to our individual as well as collective as a nation's livelihood. Misinformation about health can really damage individuals, families, and communities, whether it's making decisions that are counter to healthy, productive lives and lifestyles, or even connecting back to if we have another public health emergency like we saw 5 years ago, how do we ensure that there's an open dialogue, that people can be skeptical, can question, but still rely on evidence-based information to make the healthiest decisions and personally appropriate decisions for themselves. And so, to summarize, I think misinformation, again, is everywhere around us, but it's amplified, unlike so many other industries in the context of health and science, because of the sheer connection back to individual livelihood.
That's a really good point. And I think I want to build off of that as well as the use of the word skeptical, which sort of struck me. Like both of you all used the word skeptical, and it made me think about how, people should be skeptical of some of the information that they see on social media, on TikTok, YouTube, for example, is a the algorithm on both of those can very much lead to a lot of misinformation being fed to
Okay,
individuals.
we
But
seem to sort of be
when you
having
at
some
first
difficulty
use the
with the
word
webinar, but
skeptical, it
I
made me
think,
think
I
of
mean,
people
with the
who are
podcast, but I
skeptical
think
of
you
our.
all certainly get the point, and we covered a lot there. So first, I want to make sure to thank Dr. Bell for moderating that podcast series and having Aaron and me on there. It was a great opportunity. So I have a few questions for both of you that I'd like to start with, and then we'll play another clip and we'll get into the questions from the audience. Dr. Bell, from a cross-sector lens, what kinds of partners, whether inside or outside public health or academia, are best positioned to help rebuild institutional trust once it's been eroded?
Yeah, I mean, my normal answer is always the community. And I think that that is still the case, but I think community working either directly or indirectly with other sectors like public health, schools of public health, for example, or healthcare institutions, or even businesses, right, can be or is the way to go. But really, I think it's anyone who is willing to be honest. And I think I'm not sure if it was mentioned in this last clip. I know that we mentioned it in the podcast, is the role of former or even current mistreatment that has led to the institutional distrust. And I think that any player or person or entity that is working to address misinformation has to be honest about what is causing the mistrust, the lack of, or excuse me, the reason to be skeptical. Going back to the clip we just saw, I think that there has to be some honesty there, and in addition to the honesty, there has to be humility. So for some populations, the distrust is specifically due to previous or current mistreatment or disrespects. For other populations, the distrust of institutions might just be a part of the culture or the identity of that community. And so being really honest about where it comes from is the key to me to figuring out how to address it.
Yeah, I think that honesty and straightforwardness is so key. But it can take a long time, obviously, to build that trust. So, Aaron, I have a question for you. How do you approach conversations with groups that have been exposed to disinformation, especially when the origin is highly politicized and emotionally charged?
And that's a great question. And, one of the things that's become really clear to us in our work to listen to and engage with communities is that from a baseline perspective, we enter into these conversations with the shared value of wanting to do what's best for ourselves and our health and our families. And we can go down different paths to reach those goals. And I think we can think of many examples, especially in the context of COVID, where those divergent paths from that same shared value took different routes. And so I think in engaging with skeptical communities, those who do not necessarily understand, let alone fully respect the work in particular of public health, starting from that ground base level of shared values and moving in transparency, listening. So many of the points that you brought up, Dr. Bell, are really important to know the context, the culture of the community, really get to know people. It's very hard to at least look somebody that you know and respect in the face and say, no, you're lying, no, you're wrong. And so the foundational work that must really be at the root of all of this movement to move forward together is a critical step. And the final thing I'll say, I think I did say this during the webinar, but they often say, and I do believe it, that trust is lost in gallons and gained back in teaspoons. It's doing the work teaspoon by teaspoon to really rebuild trust.
Yeah, absolutely. And that's why it takes so long. So For either of you, can you talk about the role of intent here and what you think, how that plays a role in trying to build that trust?
Um, yeah, I mean, intent matters most. However, I would say that in addition to intent, it is the approach that also matters. So you can have the best of intentions, but if your approach is not respectful, not, I live in a context where culture is very important. You have to do things a certain way. So your approach matters, I would say, as much as your intent.
Yeah. Aaron, did you want to weigh in?
Sure, I would actually answer the question, especially looking through a lens of disinformation, that information that is purposely designed to erode trust, to sow distrust or erode to cause harm. I think that it gets very tricky, especially when distrust or disinformation is designed with a connection back to some sort of profit. For example, and I cite back to the video clip, this example of the COVID vaccine is wrong, but buy my supplements, scientifically unproven supplements, in those contexts, you have individuals who are throwing away their money and continuing to distrust public health and science. And so intent gets very murky from the disinformation side. But Dr. Bell, I so appreciate your remarks, especially as it relates to those historically cited and earned distrust examples that you're speaking about. But from a disinformation side, intent can be very hard to wrestle with.
Thanks, Aaron. And Karen, can you talk a little bit about the challenges you've observed in trying to bring together sectors that have very different values of trust in science and public health? Talk about how you managed to work through some of that.
Yeah. So one of the sectors that we have, for example, in P4HE is, for lack of a better term, the business sector, right? So these are organizations who are, working to address health, but they're businesses. They're trying to make a profit, right? So we have to contend with what their values are. Part of it is to make money. For public health institutions, educational institutions, let me be specific. Our goal is to educate students. We want to help the community, we want to be a part of the community, but we have multiple goals and multiple requirements, I will say. So I think most critical is to meet people where they are. And I know we usually use that in like a hierarchical sense, like, let me come down and, you know, talk to people in words that they understand or something. And that's not what I mean. I mean it in terms of, let me put myself in the shoes of this business, in the shoes of a public health agency, a local public health agency who is overrun, not paid as well, or stressed for time. How do we work with that organization who is trying to address misinformation in their community? We have to put ourselves in their shoes and understand what's going on. If we're talking about communities that have experienced that mistreatment, that has caused the distrust, the institutional distrust, you have to put yourself in their shoes. And that's not always possible, right? So you can't really understand somebody's experience if you haven't experienced it yourself, but you can listen. And Tim, you mentioned that takes time, and it does. And so even though we are in a potentially different context now with this administration, I really think this can be our chance as public health practitioners, public health institutions, schools of public health, to really rethink how we do this. And it's going to take more time to listen, to have dialogue, to really understand where people are coming from. So I really think that is the key, is to figure out and listen, really. And sometimes the key is to move out of the way as well. But it's really about respect and humility. And I'm going to say that multiple times, I'm sure, again. So, but for me, that is the key when you are working across sectors, is putting yourself in other people's shoes. And if you're not able to do that, or if you think that you are and you find out that you're actually not, it is to dialogue and listen and work with humility.
Wonderful. I totally agree with that. And, that's something that ASPPH is really trying to promote and really trying to inspire all of our 157 members to think about new ways of communicating, new ways of partnering, and training the next generation of students in how to partner in a genuine way, in a way where, as you say, they actually hear and listen to what the community is saying or the partners are saying, instead of trying to come in top down and telling folks, okay, we have this research project or we have this great idea, how can you do that with community as opposed to the community, if you will. Aaron, did you want to add anything to that?
Sure, that this is a big component of the work we do with the coalition, recognizing that we have almost all, but not all, of the national organizations representing scientists, public health officials, individuals in industry, individuals at the patient bedside and health delivery, and individuals who start out in this field, whether it's from a lab perspective or a patient bedside. They're waking up excited to use their talents to improve human health. And it can be very hard for them to know that there is a distrusting part of the public. And as I noted before, starting from that common shared value of trying to improve health, I'm trying to help our members listen with empathy, learn to engage, learn to be flexible, learn to figure out if we are really going to drive and build trustworthiness and rebuild trust for the long term. It is that long-term work that we do step by step, and really hopeful that we can continue to have dialogues that connect the field and professionals with individuals, having those small baby steps, small conversations that spiral into a more robust relationship moving forward.
Wonderful. Thank you both. Now I want to play the second clip, which is also about 11 minutes long. I hope it'll be a little less glitchy, maybe. We'll learn about emotional triggers, the importance of community messengers, and how literacy in all its forms plays a role in continuing this misinformation. We could roll the clip. Great.
I'm thinking of this conversation for both individuals who are consuming social media, for example, or consuming podcasts and YouTube videos, but also those community leaders who do have, a trusted voice. And so I'm wondering, when we're thinking about both the individual as well as the community leaders or community leading entities, how can we let them know what are some of the common hallmarks of misinformation? So I guess my question is twofold. What are some of those common hallmarks of misinformation? And then, are there ways that we can inform community leaders about those hallmarks of misinformation, so that we can work to combat this on the community and potentially national level? Twofold questions, sorry. I know we're not supposed to ask two questions at once, but yeah, misinformation hallmarks, and then how do we tell leaders what those hallmarks are?
Go ahead, Aaron.
Happy to take the hallmarks. Interestingly, in this last year and a half of my tenure with the coalition, I've been obviously learning a lot about misinformation, and a big aha moment for me was the fact that misinformation, disinformation often is designed to elicit a response. And so listening to yourself, when you read or consume mis or disinformation, how does it make you feel? Does it make you feel angry, anxious? Do you laugh? If you are getting some sort of an emotional read, that is a phenomenal signal that your mind and body is giving you that this might need additional research. And maybe it is completely true and you still felt all of those emotions or a emotion. But that emotional trigger is a great hallmark for everybody to think about as they consume any piece of misinformation or information at all.
Yeah, I totally agree with that, Aaron. And I think that people are so inundated with information that it's hard often to take the moment to stop and think about whether or not something is triggering that emotional response, and whether or not that therefore it's dis or misinformation. And I think part of it too is that we are separated into these two buckets so much of those who believe in public health and those who are skeptical of public health. And we need to start having more dialogue with those two audiences so that they can sort of find the common ground. There's a recent podcast that I have been listening to where some of our public health experts, including one of our deans of the School of Public Health at Yale, Megan Riney, participated in a conversation with the MAHA movement, the Make America Great Again movement. And while I'm not a big fan of the word again, because I don't think we've ever really been healthy, we all want to make America healthy. And we need to figure out how we can have those kinds of dialogues in order to try to advance the discussion and move beyond the mis and disinformation so that we can all have a common understanding and protect our health.
And Karen, to your question about how do we help, I believe was it explicitly lawmakers or individuals in positions of influence and power understand those hallmarks of misinformation. Again, I think a big component of it is who is the messenger. And when I think of the fact that misinformation is currently a political hot potato in many respects, there are efforts to curb our understanding and the scientific research behind misinformation. There are threats that anytime an individual is countering misinformation with fact, that it is an affront to the First Amendment of the person and their free speech who's free to share mis and disinformation. And so, oftentimes I think even just using the word misinformation can be triggering and make people shut down. There could be people who see the name of this podcast and think it's about misinformation. I'm not going to listen. It's misinformation. Look at the people who are speaking. They are spreading misinformation. And so, how we get back to, a form of communication that builds ground that is not explicitly pointing to, if you're speaking, it's misinformation because of my own personal bias, but helping people to identify, and again, back to your question, Karen, about who are the leaders to help kind of build the charge against misinformation. I think it has to be every consumer of information to say, do their own diligence, do their own work, and to call out misinformation when we are seeing it from, in particular, significant institutions in this country.
I was thinking, in my mind, when I was thinking of the leaders, I was really thinking more like community leaders, actually, like pastors or, not everybody is religious. So, the influential person in your neighborhood. I live in a neighborhood that's a very long-standing neighborhood that has a lot of older people. And I was just thinking about how misinformation could pass through this chain of older people. Also, it could happen through a chain of younger people, either on social media directly or just speaking to each other. So I was wondering about how to address those types of community leaders to get them to understand, and they probably already do understand what misinformation is and how to spot it, but then how can they be influential in addressing misinformation or belief of misinformation among the people that they're interacting with?
Yeah, I think it's so important that we work with and talk with audiences that aren't traditionally in science or health in order to have them be the messengers here. Because as I was saying before, people are much more skeptical of institutions and people like, deans of schools of public health because they think they have an agenda, when in fact the agenda is simply to make the world healthier. But when we see our schools and programs working with their communities throughout the country, throughout the world, I'll give you one wonderful example is the University of Memphis School of Public Health has been working with the schools in Memphis to create, excuse me, schools that have clubs for public health. And those clubs are just taking off and the students are loving it and they're really tackling the challenges of public health that we face today and coming up with their own work and working in the community. And so we're hoping that that generation of folks who've gone through those clubs will become the spokespeople on behalf of public health in the future. And we see that as a possible avenue for all schools across the country who might want to start a club for public health, because that's how we're going to change the narrative, I believe.
That's pretty cool. I wish we had a public health club when I was in school. We didn't have anything
Right.
of that innovative and forward thinking, but I agree that it's really these younger generations that are able to influence each other and then push forward a health agenda that can address misinformation, because they understand. Like, I don't use TikTok, I'm a millennial, but younger generations who are much more adept at using social media and media literacy, I think we can learn from them. And so I just used the word media literacy. I do want to ask you all about that term. Broadly, what does it mean, but also what role does it play in combating misinformation effectively?
Well, I mean, I actually have a thought about media literacy, and I'm thinking about making sure that the media is literate when it comes to these issues, right? Now, I think in general, the sort of old school media is pretty well versed in questioning mis and disinformation and really asking the hard questions and sussing out the pros and cons. I am a little worried, though, that now a lot of media feel like because they want to be fair and balanced, that they need to have people on to combat the science from those who are skeptical of the science and giving them a platform to do that. And sometimes that's totally valid, but sometimes when people are spreading falsehoods, it's really unfortunate to give them that platform. So, and I also think that the media has tended to let folks come on their media, be interviewed, and given them credibility without the follow-up questions that they need to ask. When you listen to the BBC News, and I know that's a niche market, but when I listen to the BBC News, they ask the follow-up hard question. They don't let someone just say what they want to say in their talking points. They question it, and we don't see that as much in our media. But at the same time, we have to be thinking about alternative medias, the blogs, the podcasts, the radio shows, and being part of that discussion, because those are the places where most people are tuning in now. And if we're not there talking about the importance of public health and science, it'll be subsumed by those who want to spread mis and disinformation. Great. Sorry to end with me talking and then me jumping in here, but so I want to get to some of the questions that are in the Q&A. Sally Hoger asks, what are the strategies to manage patients in healthcare who are clinging to mis and disinformation? What about coworkers who may be spreading misinformation to patients? I don't think either of you are working directly with patients, but I'm sure you have some thoughts about this.
I'm happy to jump in, and I'll take the second part of the question first. So in terms of the professionals engaging in mis and in particular disinformation, I know that the licensure boards and other professional organizations that oversee and help educate professionals of various stripes have been engaged in trying to help their members not be those that are spreading mis and disinformation, and to that end have taken some punitive action when the issue was egregious enough. In terms of engaging with patients, I'd really double down on the fact that, this is a long game, and thinking through, do you really want to further drive a wedge in the relationship between the patient and consumer? Yes, individuals come in. I'm thinking about one pediatrician within our membership who said on an 8-hour clinic rotation, she can expect at least one expected piece of misinformation, but is wildly surprised by the misinformation that she hasn't seen coming. And so part of what we're trying to do is train professionals to engage effectively in those conversations, to ask questions the right way. Sometimes you let things just boil over in the hope that you will allow for the longer development of trust in that relationship to develop. But it is really an art, not so much even a science, of how to effectively engage in ways that, again, at the heart of the discussion is one, knowing that you're both coming to this from the same value system of trying to do what's best for your health and that of your family, and trying to ensure that in the moment, especially engaging with somebody who has already bought into mis or disinformation, that you, the professional, doesn't put down such a hammer, act so aggressively in your response that you further erode trust.
Great, thank you. Karen, did you want to add to that?
No, I think that was great. You can go to the next question because I know we have more.
Okay, good. So Haifa Ahmed asks, how can we begin dialogue with online influencers when it comes to addressing mis and disinformation? Erin, did you want to go again?
I was going to turn to Karen. So I know there are a number of initiatives out there that are trying to do this in a few ways. One, by packaging evidence-based scientific information appropriately for influencers that speaks to their language. One of the things that I think is really hard for the field, and that is my membership, is the fact that we are trained by the book to get the data right. Sometimes there are liability issues at play as well. And when we are attempting to counter mis and disinformation that is agnostic to any tethers of legal issues, accuracy, fact, the data, we will never be able to meet the volume when we are hung up on getting the message as clinically perfect as possible. And so it's this fine balance for the field of ensuring accuracy, staying true to the science, but not necessarily boring everybody with a lot of data and detail and legalese that our field often feels that they need to bring to any sort of communication, including that on social media.
Yeah, very well said. And I think also we just have to become more comfortable with the different forms of media that are out there and be willing to engage and be willing to have the hard conversations. You see, some politicians doing this better and better now, where they are going to the audiences that they don't usually traditionally go to, and having hard conversations, but at least there's a dialogue that's substantive.
Yeah, I was gonna say that in different in a different way that we have health influencers. There's a contingent of, for example, professors like myself who have very large social media followings who are sort of expanding what it means to be an academic. And so it is being done. So we also have to think about how to counter those negative health influencers or those who are perpetuating or can perpetuate misinformation by really understanding what makes an influencer influential and then designing tactics to either, intervene on that or to counteract it. So I do far too much social media time, but thinking of ways to not necessarily become influencers unless you want to, but to give out that health information that is accurate, that is something that will save lives and is a part of what we call traditional public health in ways that can either counteract or stop that line between the influencer and the person who is receptive to the misinformation.
Yeah, very well said. Um, Karen, there is a question here about defining community. I think you've started to do this before, but just because I think it would be helpful for folks if you can give your sort of definition and how you would define it.
Yeah, this person asked, is it a group of people who you are hoping to reach with a particular message or intervention? Is it a group that recognizes itself as such as, a community? I think it can be both, but more so the latter. And this is like a philosophical conversation in the type of research and work that I do, but really community is a group of people that identifies with each other. And I think that that's critical when we're talking about addressing misinformation, because this is something that we also talked about in the podcast and was addressed in the clip. There are psychosocial drivers to believing misinformation and disinformation. And so really we have to expand again how we think about public health. It can be a psychological and sociological science as well. So we really have to do that additional work beyond how we traditionally think about public health and public health practice to really be studiers of people and influential on people and populations and communities.
Thanks, Karen. We have just a few minutes left, and I thought we might end by, the sort of last words of wisdom to give folks who are really trying to respond to mis and disinformation in a constructive way. And any words of advice that either of you might have.
I'll go first really quickly. When I think about the smartest people that I know, they're not necessarily the ones with the most degrees or who are working in academic or public health institutions. And so listening to and receiving wisdom from people who might not necessarily be those with the PhDs and the MPHs, but do understand people and understand their own communities. To me, that's the way to go. So that could be a grandmother. Like we mentioned in the clip, my neighbors are extremely influential on me. But these people don't have advanced degrees, but they have lived long lives and are parts of their communities. And so they have the expertise. So when we talk about addressing misinformation, I think we need to not necessarily only look outside of these traditional public health institutions, but really work with communities rather than work on them, like you said, Tim. So that would be my final thought.
Aaron, we have a minute.
1 minute, I'd really double down on those areas of common ground and shared values around wanting to do what's best for your own health and that of your family and community, recognizing that people have personal agency and there may be disagreements between the goals of public health and healthcare delivery and science and that of individuals or individual communities, but not letting not getting away from those shared common ground values, and keeping that as the focus, I think can only help us in moving forward together.
Well said. Well, thank you both so much, both Dr. Karen Bell and Aaron O'Malley, for sharing your time, your insights, and your commitment to advancing public health and equity in this challenging landscape. I also want to thank everyone else who joined us today. We hope you found the conversation and the podcast clips helpful. You can see the podcast is in the chat. And I really hope that you all will engage in efforts to try to combat mis and disinformation in these constructive ways we've been talking about today. We will be having more webinars, ASPPH webinars in the fall, and we look forward to having you join us for those as well. Thank you very much.